video, I cover a common question. Is it better to get an X-ray or an MRI to help figure out the exact diagnosis and causes of chronic pain? Expect to learn the following. Why do I usually never order imaging before doing a full evaluation? Why are most X-rays a waste of time? Why MRI is generally the best to choose? And lastly, why it is important to recognize that the imaging only tells part of the cause of the injury, not everything. For those of you that don't know me, my name is Dr. 𝘞𝘩𝘺. I am a soft tissue injury treatment expert. My focus is on diagnosing and treating adhesion, also known as scar tissue, and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long-lasting pain relief. Just a quick reminder, if you're dealing with chronic pain from an injury and you're struggling to get some real answers as to what is going on, you can submit your question directly to me, and if my insights can help, I'll be sure to get a video out to you. All the information to submit that question is available wherever you're consuming this video. So I get this question a lot, so I decided to make a video to just help educate others on what would be the best route to go when pursuing some type of imaging to help in the diagnostic process. First off is why I usually never order imaging before doing a full evaluation. One thing is it can really cloud my vision where I'm looking for that problem solely. If say I got an MRI and it came in and it said this was the problem, I'm going to be looking for things on my evaluation to match that up. It can kind of really keep me from seeing the whole picture. So usually what I like to do is get the imaging once I'm done, not before, because I want to see what's going on. And I want to make sure that I'm ordering the right image if I need to as well. And I really won't know that till I do a full history and an evaluation. A lot of times in medical diagnostic realm, a lot of doctors and providers, they just blindly order stuff because the client or the patient comes in and is like, hey, this hurts. They go in and order it. They don't do a history. They don't do evaluation. And they're just randomly doing stuff. And they wonder why we waste so much money on medical care and things like that. That's why I like to do the evaluation first, take a full history, know exactly what's going on, then be sure if I'm ordering imaging that I'm going to order the right thing. Because I've had this in the past where I've had the MRI before and I'm looking for that and it's looking like that, and then you end up missing something. I want to have all the details lined up because we got to get to the root cause of what's going on. Next part is why X-rays are usually a waste of time. They don't tell the full picture. They really just show the bone, maybe some possible infections. It doesn't include the cartilage, the disc, the ligaments, the nerves, the muscles, and tendons, all the other things that make up the musculoskeletal system. In all honesty, a lot of poor assumptions are made with these and lies are told. A lot of doctors out there will order an MRI and be like, oh, you have degenerative disc disease. You can't see a disc on an X-ray. It doesn't show us what's actually going on, and a lot of assumptions and lies are made. They do it because it's cheaper. And as I said before, anything to save a few bucks here or there. But most of the time, I'm not going to order an MRI. I'm not going to order an X-ray because it's not going to show me what I need to see. And I'm not going to have all the details. So it's not worth the extra radiation and not getting to the root cause of what's going on. So why is an MRI usually the best to choose? First off is there's no direct radiation. When you get an X-ray or a CT scan, you're getting pumped full of radiation. Radiation isn't a good thing, can cause some issues in the body. MRI does not use radiation. It's very safe. Next thing is it shows us everything that we need to look at. I'm going to see the bone. I'm going to see the cartilage. I can see the disc, the ligaments, the nerves, the soft tissue, the tendon. I'm going to get a full picture of what's going on. And next part is I'm going to get this 3D view of everything. The MRI looks at all these different angles and things like that. I can see things from the side, from the top, from the bottom. I can split things open and look at that. It gives me so much detail of what's going on. And it's the best imaging out there when I actually need to order it. Lastly is just the importance of recognizing that the imaging only tells part of the cause of the injury, not everything. A big belief of mine and why I put out a lot of these videos and try to educate people is the treatment space out there is completely broken. Too much of treatment and applying care or medication or imaging is really looking at the effect, but not getting to the true cause of what's going on. And we're all over the place. And people get these imaging or they go to the orthopedic doctor and are like, yep, on imaging, you have degenerative disc disease or you have a cartilage problem, you have that, that must be the problem. But we don't ever think, is it the cause or it's the effect? And then there's two camps of providers out there. One side is basically like the MRI, the imaging is everything and it's the only thing that we need. The other side is like, hey, your imaging doesn't matter. Everyone has these problems as part of normal wear and tear in the body. Both sides are wrong. It's somewhere in the middle. The imaging is important, but it doesn't tell us everything. But a person is having extreme pain, they make an appointment into an office to get evaluated, the chances of the disc and the cartilage and the tendons being a problem are very high, but it's not everything. We need to know the entire picture. And so much of medicine is just focused solely on getting to the effect, but not to the true cause. And if you don't know what a problem is in the first place, you have no chance of ever being able to fix it. That's all I got for you in the video. I appreciate if you watched it. If you learned anything, that would be awesome. That's why I make these videos. And lastly, if you've been dealing with a chronic pain from an injury, I'd say for at least 6 months, you've seen way too many providers, you're still having issues, then reach out directly to us to set up an injury consultation to get some real answers as to what is going on and get on the path to long-lasting pain relief so you can stay away from pain pills, injections, and surgeries, which definitely make things worse. All the information to request that consultation is available wherever you're consuming this video. I appreciate you watching, and we'll see you on the next one. Bye.